Hello, my name is Nelson Virgil. I'm the founding director of Program for Wellness Restoration, or POWER. It's a nonprofit organization that I opened in 1994 to help people live better with HIV. I've been positive for almost 30 years. I've learned a lot about the disease through my own battles with it. And I'm here to tell those of you that just found out you're positive and a little overwhelmed about what to do next. The main things you need to take care about for your health in the next few weeks. The first one is you have to find a good doctor. That's probably the best decision, the most important decision for an HIV positive person. And that's not an easy task sometimes, to find a doctor that has a lot of experience in HIV. Has to have at least 50 patients that are HIV positive, a person that has been treated HIV for at least 3 to 4 or 5 years. And sometimes you don't have a choice. Sometimes you don't have insurance, so you have to go through a public clinic and you're assigned a doctor. But if you do have a choice, try to do some research in your area. Ask people in the different nonprofit organizations in your city. Go online, and I'll give you some resources at the end of this video on how to find a good doctor that treats HIV. That's a very important first step. The next step, obviously, after you find a doctor, is to find out what your immune system, how your immune system is doing with measurements of your CD4 cells, your immune cells that actually fight HIV and the ones that actually tend to be destroyed by HIV, and the viral load, the amount of virus you have in your blood. And a third test that is very important, and it's kind of a newer test that was not really standard a few years ago, is what we call a genotype test. It's a resistance test, just to make sure that you did not get infected with a virus that had already pre-existing resistance or mutations. Sometimes when people are taking medications and they infect others, they can transfer some of the resistance of their medications they've taken in the past to the person that just got infected. So you want to make sure you're not one of those. And if you are, the medications have to be selected such that will provide an effective control of your virus. I'll speak a little bit about that too. One thing that I don't want to ignore is that some people don't have insurance. Some people have insurance, and HIV is a very costly disease to treat. A tripla, the main treatment for HIV, costs anywhere from $15,000 to $19,000 a year. So most people cannot afford to pay for that medication and the blood test. So we have drug assistance programs in every state of the United States of America. And I'll give you some resources on how to find out where your closest clinic that provides complete, assistance, depending on your income level, of course. If you're making too much money, then you have to find out other ways like insurance, private insurance. And if you do have insurance, obviously, you do have easy access right away to a doctor. So first of all, if you're HIV positive, you find out you're positive, you get tested, obviously. You have to find out where to fill out all these forms for the assistance programs, and then they'll proceed to help you, to place you with a doctor and a clinic that can treat you for free. So that's good news in the United States. And also, after you find out your blood work, your CD4 cells, your viral load, and whether or not you have resistance, your doctor can sit down with you and go through different treatment options. And we have a lot of them now. It's an amazing thing that when I found out I was positive, there was not a single medication, and now we have over 28. And we have a lot of new drugs that do not cause the side effects that the old drugs used to cause. So don't be too stressed out about it. I'm not saying they're all benign, but the side effects can be managed a lot easier. We have a few once-a-day treatments, which is really great. I used to take meds 4 or 5 times a day back in the old days. A tripla is the number one, the most commonly used one, because it's the one studied the most. But there are other ones that just, Complera was also approved, but you need to talk to your doctor because medications work better for some patients and not for others. Boosted Reatas with Truvada, it's another once-a-day treatment. And very soon we're going to have a drug called combination drug Quad, which is an integrase inhibitor plus Truvada. So those are the once-a-day treatments. There are twice-a-day treatments which are also wonderfully effective, like a Centris plus Truvada. So it's kind of very hard for somebody new in the HIV field and the HIV world to make up their minds about which one is best. But your doctor, a good doctor, can sit down with you, go through all those options, pluses and minuses, potential side effects, or or benefits, and your viral load and CD4 counts can actually help your doctor and you actually, because it's a decision that the two of you have to make. Not only your doctor, but you also have to agree to a certain drug regimen. And after you do that, and it's a big step to start taking medications. I think that most people are terrified. I get emails. I'm an expert for thebody.com, and I do lectures all over the country for the past 16 years or so. The first question people ask me is, am I going to get lipodystrophy? Is my face going to go? Are people going to be able to see that I'm HIV positive because the medications are going to change my body? Luckily, the newer medications don't cause us disfiguring side effects. We don't use those drugs anymore. You do have to exercise and eat well and make sure, because as your immune system gets better, you can probably gain some weight. But exercising and eating well and making sure you follow your blood work can prevent a lot of those changes. So don't worry about lipoatrophy, facial wasting, that lipobelly, because it really isn't as big of a deal as it used to be. So if that's your fear, don't worry about that, okay? And yes, you're gonna have to remember how to take your meds on time, and that's important, especially if you have never taken vitamins. People start taking vitamins for years. So they're used to taking something, and some people have never taken a pill in their life. So it is an adjustment, and it's something that you have to find ways to adhere to. Pill boxes, reminders, text messages. There are some programs online you can get through the resources I'm giving you at the end. Things that remind you to take your meds on time, okay? You also have to know what the food requirements of certain medications are. There are two medications, like a tripla is taken on an empty stomach, because if you take it with food, it may actually increase the blood levels a little too high, and you may get some side effects, like wild dreams and all that. And other medications like Complera, you need to eat with it, or other medications. So your doctor has to explain to you how food interacts with your medications. And it's not too complex. Thank God most of the medications we have right now don't have really horribly strict food requirements, but you do have to talk to your doctor about it. Stop smoking. If you're smoking, stop smoking. Find a program, smoke cessation program. So there's some of them that are provided for free in nonprofits that work in HIV. Talk to your doctor about treatment options for smoke cessation. Smoking is a huge risk factor for cardiovascular disease, lung cancer, and we in HIV tend to have a little bit more of a risk of cardiovascular disease. So you don't want to add that to the complexity of the disease. And if you're drinking alcohol, a lot of it, cut down. I'm not saying all the way. You can moderate 2 drinks a day max, red wine, or you want to have something with dinner. But be careful with too much alcohol consumption. It's not good for your liver, and you may actually forget to take your meds. And it's just not good for your metabolic rate. You can actually gain fat a lot more with alcohol. So, it's not a good thing. But, your mother, your grandmother told you this anyways before you were positive, right? Manage stress. Stress is very important. I really think that we don't emphasize that strong enough. I've probably lost most of my CD4s in the past because of horrible, stressful times that I did not know how to manage, or depression. It is a shock to know you're positive. You're going to deal with some stigma you were not used to. The dating game is definitely more complicated. To tell somebody that you like that you're positive, it's very stressful, and that's probably the biggest challenge. Most of us have to find some really inner strength that we didn't know we had, so that we can do the right things for our health, protect others, be honest with others, slowly and surely telling people that we love that we are HIV positive. That's very stressful. So find support. Talk to your best friends. Go to support groups, nonprofits like, as I said, AIDS service organizations, and there's a listing I'm going to give you at the end. Have support groups of people that have been infected for a long time. Some people are just newly infected. Find ways to relax, and exercise is a great way to manage stress. Volunteer. I mean, lots of nonprofits are hurting right now. We don't have enough money. We don't have enough manpower. We need to do fundraisers. Get out of the house, meet other HIV positive people or people that really care. And they don't have to be positive. They have to be HIV friendly. And read, do what you like. And try to enjoy life because really life is short, and we will live a long life like everybody else. It's not like we're dying anytime soon. But it is important to manage stress because stress can really affect your immune system and your immune response and your depression and your mental health. So find ways, hobbies, volunteer, get out of the house, talk to people, join support groups, do what you love, get some hobbies, get a puppy, whatever it takes, because that's really important. Eat healthy and exercise. Well, we hear this all the time. Our mom, grandma, everybody around us. But what is it? What is eating healthy? Eating healthy is basically lowering your sugar intake. You can have your desserts once in a while, but don't eat too much sugar. Don't drink sodas, diet or not. Drink a lot of water. Eat lean meats, fish, nuts, vegetables, fruit. Try to avoid the sugary stuff, the junk foods. You know all that. Most of us know what's right or wrong, but in HIV it's very important because we have some metabolic problems with cholesterol and triglycerides that may make us more prone to having cardiovascular disease, and we may even gain some weight. So, no sugar, lots of fiber, lots of good meats like, fish, chicken, lean meats, vegetables of all kinds, fruits, nuts. Nuts are very important, yogurt, and try to not buy so much processed meat, foods, and junk food. Exercise, important, very important for everybody, positive, negative, everybody. But for us, it's probably more important than for most people because not only we keep our bodies in shape, but also exercise can be good for the immune system. Exercise can make us prevent a lot of these body changes that may or may not occur. Our bones may actually we may lose bone density in HIV, a lot of us do, without even medications. Medications may make the bone loss a little bit more concerning. And exercise, especially weight training, resistance, push-ups, squats, crunches at home, walking every day is actually good for the lungs, good for the immune system, good for your body. And it's also a way to help you manage side effects like high cholesterol and triglycerides or blood sugar problems. So exercise is really one of the best medications in HIV. We don't obviously there's not a pill that we can take to avoid exercising, and unfortunately, I don't hear doctors prescribing exercise, which every doctor should prescribe exercise to their patients. And there are also some nonprofits that provide free exercise counseling too. Vaccines. If you should get tested for hepatitis A and B and C, because those are three hepatitis that you can have without knowing because they're not real symptoms. At A, you have symptoms, but and if you're free, you were never exposed to A or B, ask your doctor for the vaccines for those two hepatitis. There's not a vaccine for hepatitis C yet. There are treatments, but that's not the scope of this discussion. So A and B. There's also a new vaccine for men under 26 and women, also young women, an HPV vaccine, the human papillomas virus that can cause cervical cancer in women and anal cancer in both women and men, throat cancer, etc. There's actually a vaccine, very effective, but it's only prescribed to men and women under 26 years of age. It's a new vaccine. It's a very effective vaccine. I would actually get it if I was under 26, but I'm definitely not under 26. And the Pneumovax vaccine is for bacterial pneumonia. Also, if your CD4s are above 600. So talk to your doctor. Doctor, what do I need when it comes to vaccines now that I'm HIV positive? Shingles too, if you're prone to shingles, there's a shingles vaccine. So the doctor will be able to talk to you about it. Become knowledgeable about your disease. Some people don't want to hear about it. They test positive, they take meds, and they just don't want to hear about HIV. And that's fine. They may not need to. Some people are doing fine. They take their triplet, they take their pills, they don't have side effects, they don't think about HIV, and I say, well, good for them. That's actually the way most of us should live. But some of us may have a side effect here or a concern there, and it's important to have information, and really good information. And luckily, we have wonderfully effective newsletters in this country You can subscribe to a newsletter at thebody.com. I'm a bunch of there's probably 20 experts there that answer questions. I have a column there. You can send me emails and I'll try to answer your questions. You can subscribe to magazines, free magazines like PAUSE, POZ, and Test Positively Aware, which is another magazine that's free. So if you had those three sources of information, you're probably doing pretty well. Thebody.com, which is a weekly newsletter you get by email, and PAUSE or Test Positively Aware, they're mailed to your house. Okay. If you once you find out your CD4 cell counts, and if they are under 200, which is a little concerning, you may be more prone to having some other infections. Your doctor will probably put you on something called Bactrim. It's one of the options. There are others to prevent PCP pneumonia, which is probably the #1 cause of illness in those that have very low immune systems. Usually when you start medications, your CD4 cells are going to go up, your immune system is going to get better. Some people go up a lot faster than others, so don't be comparing yourself, don't be worrying so much that, because in some studies have shown that people CD4 cell counts still go up even 5 years after they start treatment. So sometimes it's a very slow process. At the beginning of the first 4 months, you're going to get, 50 to 100 CD4s, and then slowly but surely things start stabilizing. So don't get too stressed out about whether or not your CD4s are going up fast enough. If you have fatigue, sexual dysfunction, depression, lack of focus, ask your doctor to test you for hormone levels like testosterone and thyroid. Because if you have low either thyroid or testosterone, you will have all these symptoms, and those hormones can be replaced with treatment. And very, very mainstream nowadays to do that. But you do have to talk to your doctor about it, because some doctors are not probably going to bring this up, especially the sexual dysfunction part of the. And I'm not saying that HIV positive have more sexual dysfunction than negatives. It's just that it's something that most of us go through because of aging. Take a multivitamin a day, any kind, whatever is cheap that you can get out there. Just to make sure that you're covering your B vitamins and your minerals, even if you're eating well. This is an inflammatory disease that may require more macronutrients in your body. So take one a day at least. If you want to be fancy, you can go on my website and see a more complex regimen. I really do not recommend it for those who are just starting treatment, because you're starting to get ready to start taking pills, and you don't want to overload and overdo it, okay? Vitamin D, though, is very important. Vitamin D is one of those hot vitamins that every researcher is talking about that may prevent a lot of the bone loss that we may see in HIV. We don't have long-term studies, but it's a cheap vitamin, 2,000 to 4,000 units a day. It's good enough, and it doesn't have any toxicities. Last but not least, try to avoid activating your immune system. What does that mean? Every time you get a new disease, let's say you're having unsafe sex with somebody and you get an STD like gonorrhea or syphilis, your immune system is fighting the new infection. And when that happens, it activates it. Everything goes crazy and starts, and that's not good. That actually is not good for the immune system. It overtaxes the immune system. It can actually cause some viral load increases. It can cause some CD4 decreases. So try to protect yourself from other infections by, making sure that you get tested for STDs. If you're very sexually active, try to, as best as you can, to have safe sex. If you're not having safe sex, talk to your doctor about it. There's, some doctors are going to talk to you in very frank terms. But do make sure that if you have any STDs, you're treating them fast and you're detecting them fast. For more information about all I've talked about, you can go to the website of my nonprofit, powerusa.org. That's POWER USA.org. I have a lot of information about everything I talked about. I have a resource list and information on different topics in HIV. So just keep your faith. It's going to be, it gets better, like the videos say, it gets better. And, there may be a cure within the next, few years. And it's something to look forward to and something to attain to stay healthy for. So, and if you need any more information, go to the website, or you can send me a question at thebody.com under the experts column. Thank you very much, and I hope you enjoyed this video.